I'm so excited to be talking to you today about one of my favorite topics, testosterone. I titled this What You Need to Know. My name is Dr. Jeremy Ipson. I am the medical director at Santan Natural Medicine in Gilbert, Arizona, and you may have found us on our site, testosteronegilbert.com, one of our sites that focuses on testosterone. Anyway, so let's jump into it. You may or have heard of testosterone. It's a pretty common topic nowadays. If you listen to the radio at all, there's often many commercials out there. So testosterone, we know testosterone deals with big muscles. We know testosterone deals with sex drive and libido, but really there's a lot more to that about to testosterone than just muscles and libido. So let's talk about it just a little bit more. So what is testosterone? Testosterone is an androgen hormone that makes your cells grow and function like they need to. It's a very important hormone. Almost every cell in our body uses it on a daily basis for us men. And you see that big number up there. Every day if we're producing optimal testosterone levels, we need 15 quadrillion molecules of testosterone. That's a huge number that often we don't think about. So even just a small little deficiency in that can have a big effect in how your body functions and performs, and energy levels, and your ability to grow muscle and everything else we're going to talk about. So and not only is testosterone important, but its balance with the other hormones that you have is also very, very important. So signs that you may have low testosterone: you may have heard of the low libido or the difficulty with workouts and endurance and different things like that. So there's a lot more to that than just those signs. Some common ones are, fertility issues, reduced desire and libido. Obviously, there's also a decrease in energy, especially kind of the mental kind of outlook for motivation and kind of focus and self-confidence is a big part, and even just overall depression. As I see a lot of men with those depression symptoms coming back with actually low testosterone instead of depression. So that's definitely worth looking into. Testosterone is important for memory, for sleep patterns, for physical performance, and even physical appearance and sexual performance as well. Testosterone is very protective of bone and joint tissue. So if there's regular injuries, that could be a sign of low testosterone, or especially slow recovery after injury, that could be from low testosterone as well. And there's also a component for memory, as I mentioned there too. So there's others as I was flipping through that you might have saw more that could be affecting you. So not only is low testosterone itself a big issue, but it also has links to many other conditions, especially type 2 diabetes, obesity, erectile dysfunction, cardiovascular disease, dementia and Alzheimer's, all kinds of it. Prostate is a big one that's connected with it. And especially for men who have osteoporosis, low testosterone is a big factor. So either low testosterone leads to these conditions getting worse, or these conditions cause testosterone to be decreased. There's definitely some playback with a lot of those. So testosterone is very important. Like I said, not just for muscles, not just for sex drive, but for just an overall functioning for men especially, but women as well. That's a different topic. But all right, so if you were able to get your testosterone into optimal levels, then you would notice increase in muscle growth and preservations. Your workouts would be better. Your endurance, your energy, your cardiovascular health would be great. Optimal testosterone levels long-term lead to decreased risk of heart attacks and stroke, decreased risk in Alzheimer's, decreased risk in cancer, all kinds of benefits, not just in the short term, but the long term. So, and like we talked about a little bit earlier, healthy moods and mental clarity and self-confidence is a big deal with optimal testosterone. So what is an optimal testosterone level? Depending on what lab, if you have had your testosterone checked, depending on what lab you had, a normal level is somewhere between 350 and 1100. Some labs go down to 250. Some labs only go up to 900. Every lab's a little bit different. But what I like to go off is kind of more an optimal range. An optimal range is 600 to about 1,000, but it's a little bit different for everyone. There's some different factors that can be affecting it. But where that optimal range comes from is the long-term studies I alluded to earlier about cardiovascular health, Alzheimer's health. or prevention and cancer prevention, those studies are showing a testosterone in this higher range is what is proving those benefits. And even just being slightly below that, those benefits aren't there. And so, and then also on a day-to-day basis, the 600 to 1,000 range is where people feel the best on a day-to-day basis as well, in most cases. So that leads us to the question of what can I do if you have low testosterone? So there's multiple treatment options. Our favorite, and we do a lot of, is testosterone replacement therapy. There's different modes of applications to be able to do that. Testosterone replacement therapy is very safe. It's using what's called physiologic dosage, which is a dosage within the normal range, kind of get you up into the optimal range. And when you operate in those range, or when you get there, there's really almost no side effects that are associated with that. So definitely safe and safe long term. It's when you get above the optimal range and start to move into called supraphysiologic, so above 1,200 and up into the higher 2,000, 3,000s. That's when you start to develop side effects and have big issues. And so we don't do that with any of our patients. We just work on the replacement levels, keep people in the safe and healthy and optimal ranges. So and there's the intricacies of working with the testosterone and getting that to balance and have good healthy levels, which we have a lot of patients that are doing that. Another option would be to try to go the natural route of boosting it, which with diet and nutrition and supplementation and workouts. And you, depending on how interested you are in testosterone, you may have read different articles on men's magazine sites that doing this might boost your testosterone by 20%, or doing that might boost your testosterone. Those boosts in testosterone are usually just a temporary thing. To actually get full natural testosterone boost up to good optimal ranges does take a lot of work, especially if you are low. A lot of clean dieting, detoxing, nutrition is a big factor. We do help patients with that. But doing those things along with the testosterone replacement therapy can have even greater effects. So that's why we have the combo treatments mentioned there. So anyway, yes, testosterone replacement therapy, very safe and effective for getting that testosterone up into the optimal ranges. So, all right. So I have a special gift for you if you've made it all the way to the end of this video. Over on the screen to your right, you can click, and there is a little form you can fill out to get access to a questionnaire and a free blood test. So you can come into our office, get your testosterone level drawn for free, fill out a little questionnaire, go over the questions with you, and see if you would be a candidate for a testosterone replacement therapy or another way, just an overall evaluation of your testosterone level. So I hope to see you in office soon. Click the link off to the side, fill out the form to get your blood test and your questionnaire filled out, and then we'll see you soon. Thank you very much.